So now I'm going to show the tray seating process. You can see just isolating with a cotton roll on the lingual and a slow speed suction right on the teeth itself. I can tell you that, as we all kind of do, the ability to isolate sometimes is a little challenging. So you can see here, we always just try to find the best way to do it. The NOLAs, I've used NOLAs in the past. I really don't like the NOLA. The patients don't like them. They kind of get in the way when I'm doing the indirect process. And I've found that, we rarely, I think maybe one bracket a month out of 40 bondings, 40 or 50 bondings, will we lose a bracket. Like it just doesn't happen. So we just take our time, focus on isolating at that time and make sure it's all good. So that's how we seat the trays. I mean, they go in, you can see I like I like using a sextant on the lower arch because I feel like I can really isolate the posterior segments by themselves and then the anterior because the lip sometimes will ride up on the um, teeth. I can blow them again, blow them dry again, make sure that it's all good and get it isolated with my finger or cotton rolls and go from there. The tray removal process. And so the tray removal process, we go from the lingual and go and roll it over. I believe Ruse talks about leaving the little tab on the lingual. There's a tab that comes on the trays that has the patient's initials and upper left, upper left, lower left, upper right, lower right. Um, I, I've had a hard time with those tabs. I think I know the team likes them, but they do like them when I do leave them on, but sometimes they're a little bit too long, sometimes they're a little bit of a hassle, and sometimes the tongue is pushing on them. And I don't feel as confident that it's not maybe moving some things around too much. So I don't typically leave the tabs on, but I can definitely see the benefit of leaving the tabs on to help this situation where you can take those and help leverage it out. But we seem to do pretty well. And by this point, I'm well gone from the appointment. I've been gone for about probably 10 minutes or so, 10 or 15 minutes off to the consult or off to the next adjustment or off to the next indirect bonding, fortunately for us. So you can see here, and that's not me cherry picking. I mean, this is somebody that we said we're going to go from start to finish on, and we did. And all the brackets are there. We push on them. We want to make sure that they're not just holding on by a string. We want to make sure they're really in there. So we give them a pretty good little push to make sure that they're on there really good and not just hopefully staying on. For indirect, if we take those trays off, you saw how rigorous you need to be to get those trays off of there. And if the brackets stay on for that, they're usually on there pretty well. So rarely do we have any issues with that.